Why did you choose to do the Deuk laser disc repair instead of any other type of surgery?
So I've been looking at having my back repaired for well over 2 decades, and I didn't want to do it because I was afraid of the fusion. And I looked at all the other options through literally decompression therapy twice, 20 plus years of injections in my back. I've had 7 in the last 12 months in my back, to include decompression therapy. I did everything that I could, and quite honestly, it was a blessing that I found you. Otherwise, I'd probably, because I'm retired, I was probably looking at a fusion, and that's not what I wanted to do.
Good morning, I'm Dr. Deuk. I'm here with one of my patients who is actually retired military.
Yes, sir.
And you live locally, which is a bit unusual for us. You're in Orlando area, an hour away. And just yesterday, less than 24 hours ago, you were having surgery here at the Deuk Spine Institute. You had the Deuk laser disc repair to fix 3 herniated discs in your back. How do you feel today?
I feel wonderful. No pain at all.
Pain from before surgery is?
Gone.
Completely gone?
Completely
in
gone.
your back and your legs?
And in my legs.
Awesome. So how long did you have that pain for?
My back pain is in excess of 40 years. I hurt my back while I was in the military in South Korea many years ago, and it's progressively gotten worse over the years.
And before you had the surgery yesterday, it was constant?
Constant pain. For the last 2 years, it's been constant. And then the legs got really bad.
All right, and the legs mean both legs and pain going down the legs. What other symptoms did you have in your legs?
Numbness in my toe and the knees for the most part, just weakness in the knees going in an incline or upstairs.
So you had the pain in the back and it went down the legs, and you had weakness in your legs and numbness in your toe.
Correct.
And I know a lot of that's better today, especially the pain.
Yes, sir.
The numbness takes time to get better. It usually takes 6 months for it to go away. So we just have to be patient. Why did you choose to do the Deuk laser disc repair instead of any other type of surgery?
So I've been looking at having my back repaired for well over 2 decades, and I didn't want to do it because I was afraid of the fusion. And I looked at all the other options through literally decompression therapy twice, 20 plus years of injections in my back. I've had 7 in the last 12 months in my back, to include decompression therapy. I did everything that I could, and quite honestly, it was a blessing that I found you. Otherwise, I'd probably, because I'm retired, I was probably looking at a fusion, and that's not what I wanted to do.
And you found us online.
I did.
And you learned about the Deuk laser disc repair.
I have.
What were the most surprising thing you learned about the procedure?
The ease of it, the recovery time, the post-op, people that are going home same day, and then the testimonials, quite honestly, from your videos that show people coming back not necessarily the next day, but 6 weeks later, and even some a year later.
So yeah, we have people from all over the world that come here, as a matter of fact, to Deuk Spine Institute, because the endoscopic Deuk laser disc repair you had done isn't offered anywhere else.
Right.
So
my thought process was, you know what, let's give this a try, and I'm sure it's going to all work out fine. And worst case scenario, you know, get another 10 or 20 years out of it, we'll see. You know, I'm very pleased right now. Not disappointed in my decision whatsoever.
Well, is your pain in your back gone because you're on narcotics right now?
No narcotics whatsoever, none.
Yeah, we don't do narcotics with the laser surgery. That's one of the advantages. You know, if you had a open back surgery like a fusion, you'd be on narcotics for a couple of months, you know, just recovering.
Right.
So, and your surgery was outpatient, right?
Yes, sir.
Yeah, we didn't even go to the hospital. It was just done right here.
Right.
Anything else you want to tell our audience, those people especially that believe that back pain is not curable?
I would just ask that you dig deep inside yourself to determine what you want to do to make your life better. And you know what? Fusion is a very tough solution. At least give Dr. Deuk and his staff the opportunity to review your case and see what they can do to help you.
Well, congratulations on your
sir.
result. I'm
Yes,
very
sir.
happy for you.
Thank you.
Take care.
Me as
Go
well.
eat lots of kimchi.
I'll do it. Thank you.